Hi, good morning Taylor. My name is Mihira. I'm your invigilator for the OET-speaking session on the 21st of July 2023. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name, for the record please?
My full name is Taylor Scott.
And what is your candidate number?
My candidate number is 772212277.
Okay, and are you taking this test as a nurse?
Yes, correct.
All right. Can I see your ID, please?
Sure. Here it is.
Thank you for the verification. Now, let's move on to the warm-up sessions. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Why are you taking the oath?
As a nurse, I am taking the oath to demonstrate my English language proficiency in the healthcare context. This will allow me to effectively communicate with patients, colleagues, and other healthcare professionals. Strong language skills are crucial in providing quality healthcare services and ensuring the best possible care for patients. Additionally, passing the oath will open up opportunities for me to work in various healthcare settings worldwide.
Please brief me about your career.
Throughout my nursing career, I have been dedicated to providing compassionate and high-quality care to patients in various healthcare settings. I have worked in both hospital and outpatient settings, gaining valuable experience in patient assessment, medication administration, and wound care. Additionally, I have actively engaged in continuous professional development, attending workshops and seminars, to stay updated with the latest advancements in nursing practice.
Tell me about the last training you had.
My last training was on infection control and prevention in healthcare. It covered hand hygiene, PPE use, and environmental cleaning. It enhanced my skills in ensuring a safe environment for patients and healthcare workers. During the training, I also learned the importance of prompt identification and management of infectious diseases to prevent their spread. I am now better prepared to implement best practices and contribute to maintaining a sterile and secure healthcare setting.
How do you think working abroad will benefit you?
Working abroad as a nurse will provide me with valuable international exposure and a diverse range of experiences in different healthcare systems and cultures. It will enable me to enhance my clinical skills, adaptability, and cross-cultural communication, making me a more well-rounded and globally competent healthcare professional. Additionally, I can learn and implement best practices from different countries, bringing new perspectives and approaches to patient care. Working abroad will also offer personal growth opportunities, broadening my horizons and enriching my understanding of global healthcare challenges and solutions.
What are your career goals?
My career goals as a nurse include continuous professional development and advancement in specialized areas of nursing practice, such as critical care or pediatrics. I aim to pursue higher education and certifications to further expand my knowledge and skills in providing specialized and evidence-based care to patients. Additionally, I aspire to take on leadership roles, becoming a mentor and advocate for nursing excellence within the healthcare team. Ultimately, my goal is to contribute significantly to improving patient outcomes and the overall quality of healthcare delivery.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihira.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you, Mihira.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your role play. Don't worry if I stop you when the time is up.
Good morning. My name is Taylor Scott, one of the nurses in the clinic. How can I assist you today?
Good morning. I'm here because my 6-year-old child is scheduled for an MRI scan, but I'm quite concerned about it.
I can see you are a bit worried. Please be relaxed. I am here to assist you. Before proceeding, how can I address you?
You can call me Mihira.
Mihira, can I have your child's name, for the record please?
His name is Miles.
Nice to meet you, Mihira. Thank you for the details. Now, Mihira, it would be great if you can vent your exact concern, so that I can assist you better.
Can you please explain why my child needs to undergo this scan? Are there any other options left?
Of course, I'll do my best to help you. I don't have access to your child's medical records, but I can provide general information. MRI scans are commonly used to obtain detailed images of your child's internal organs and structures. They can help in diagnosing various medical conditions or monitoring existing ones. Thereby, the doctor can provide the appropriate care for Miles.
Yes, it might be, but I'm feeling quite anxious about the MRI procedure for him.
I understand that medical procedures can be worrisome, especially for children. MRI scans are generally safe and non-invasive, and our medical team takes every precaution to ensure your child's comfort and well-being during the process. We'll provide ear protection to minimize any noise from the machine, and we might use sedation to help Miles stay calm and still throughout the scan. Sedation is commonly used for young children to ensure accurate imaging results and make the experience more comfortable for them.
I see. Sedation does make me feel better about the procedure. But what preparations do we need to make before the MRI?
I appreciate your consciousness. Preparing for an MRI typically involves fasting for a few hours before the scan. It's essential to follow any dietary restrictions and fasting requirements provided by the medical team to ensure a successful procedure. Miles requires fasting for 5 hours before the MRI.
Is that really needed? Because how can a 6-year-old manage without food and drink for 5 hours?
Mihira, fasting is a necessary safety measure to ensure accurate imaging results and improve the chances of a successful procedure. Your thought is quite natural. This can be addressed by providing IV fluids. I will let you know in detail about it.
You may please. Because providing IV will be painful for my child.
Mihira, we will be managing it without any pain. First, a numbing cream is applied to minimize any discomfort from the IV insertion. After applying the cream, IV fluids may be administered to keep your child well hydrated and maintain their body's balance during the procedure.
I appreciate your explanation. Lastly, are there any potential side effects my child may experience from the MRI or the sedation?
While MRI scans are generally safe and sedation is well tolerated by most children, there can be some mild side effects. These might include drowsiness or nausea, but they are usually temporary. Our medical team will closely monitor your child during the procedure and be prepared to manage any unusual reactions if they occur.
That's good to know. Before we go, can you provide me with some information on how to care for my child after the MRI? Are there any specific instructions I should follow?
Of course. After the MRI, Miles may feel a bit drowsy due to the sedation. It's essential to let him rest and take it easy for the remainder of the day. Offer him plenty of fluids to stay hydrated and a light, easily digestible meal if he feels hungry. In case of any persistent drowsiness or nausea, don't hesitate to contact us or your GP for further guidance. We'll also provide you with a written post-procedure care sheet with detailed instructions.
Thank you for addressing my concerns. That's helpful. Thank you, Nurse Taylor, for all the information and support. I feel much more prepared now for my child's MRI scan.
You're welcome. I'm here to assist you in any way I can. If you have any more questions or need further support, please feel free to reach out. We're here to help you and your child through this process.
Thank you, Nurse Taylor. That is the end of your OET-speaking roleplay. All the best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.